Hello, I'm Dr. Brandt Gibson, and tonight I want to talk to you about accessory navicular, and I'm going to answer the 4 questions to help you understand what that is. So, first off, look at the anatomy here, and you've got the navicular bone, which is right there. And the navicular bone can sometimes have an extra bone. So if you look at the navicular bone, let's see if I can get it in a position. Okay, perfect. You get a navicular bone that's sitting right there. If you have an extra bone that sits almost right underneath it or right at the edge of it, that would be the accessory navicular. It's usually an extra bone, accessory bone, whatever you want to call it. Often it is there from birth and doesn't cause pain for a long period of time, for years. And then as it starts to calcify, sometimes in youth or young adult age groups, it will start to be painful. We've had some actually where it hurts later on in life, but it's actually an extra bone. And the problem with it is sometimes it interferes with the functioning of the posterior tibial tendon, and that can be cause pain, or it may rub on shoes, which can also cause pain. Number 2, why does it happen? It is genetic. The idea is you're born that way. The way the bones form is they're cartilage initially, and then they calcify. In some cases, you get areas that are supposed to fuse that don't fuse, and you get an extra or an accessory bone. And if it doesn't hurt, we don't care. But when it becomes painful, it can become pretty problematic. Number 3, what can you do for it at home? Really, it's shoe related. So if you can find shoes that are comfortable, that are not rubbing on it, not causing pain, if you can wear certain types of inserts or arch supports, those kind of things, sometimes that can reduce the symptoms in it. But really all you're doing is treating symptoms, because there's nothing you can do to make it go away at home. Number 4, once you see the doctor, if it becomes painful, if it gets to the point where it's starting to bother you, rubbing on shoes, creating blisters, causing significant pain with walking, interfering with the tendon enough that your foot starts to flatten out, all of those are reasons to be seen by the doctor, because the treatment for this is either a custom orthotic, if it's just the tendonitis that you're treating, or surgery where you actually remove the accessory bone. This is Dr. Brandt Gibson, and this is your Podiatry Tips Day 189, Accessory Navicular. Thank you, have a great night.